Can Barrett's esophagus cause a cough? Have you ever wondered if Barrett's esophagus can lead to a persistent cough? This question is important for many people dealing with digestive issues. Let's break it down together. Barrett's esophagus is a condition that affects the lining of the esophagus. It usually develops in individuals who have long-term gastroesophageal reflux disease. Gastroesophageal reflux disease, often called GERD, causes stomach acid and other digestive fluids to flow back into the esophagus. This backflow can irritate the lining over time, leading to changes in the tissue. Now, regarding the cough. A cough can indeed be linked to Barrett's esophagus, but it is often due to the underlying gastroesophageal reflux disease rather than Barrett's esophagus itself. GERD is known for causing symptoms like frequent heartburn and acid regurgitation. These symptoms can irritate the throat and airways, which may trigger a dry or chronic cough. When the acid from the stomach irritates the esophagus and throat, the body tries to clear it out, leading to that annoying cough. People with Barrett's esophagus may experience this cough as part of their reflux symptoms. Along with coughing, they might also notice hoarseness, wheezing, or a sensation of a lump in the throat. These symptoms occur because acid reflux can affect the upper airway and vocal cords. Interestingly, Barrett's esophagus itself does not usually cause new or unique symptoms. Some individuals with this condition may even have little or no reflux symptoms at all. However, when symptoms do appear, a chronic cough is a recognized sign linked to the acid reflux that contributes to Barrett's esophagus. For those with a sensitive stomach, irritable bowel syndrome, or colitis, managing reflux symptoms is especially important. Digestive discomfort and inflammation may be more pronounced in these cases. Acid reflux and the resulting cough can worsen overall digestive sensitivity. To manage these symptoms, it is helpful to avoid foods and drinks that trigger reflux. Eating smaller meals and not lying down soon after eating can also make a difference. Following medical advice for treating gastroesophageal reflux disease and Barrett's esophagus is key. Addressing reflux symptoms can help reduce coughing and improve overall quality of life, particularly for those with sensitive digestive systems. So, to answer the question, Barrett's esophagus can be associated with a cough, but this is mainly due to the acid reflux that causes the esophageal changes. The cough is a response to the irritation from the acid. Managing reflux effectively is essential for controlling cough and other related symptoms.